Your kid just threw up. What do you do next? Do you feed them? Do you wait it out? Do you call the doctor? Do you go to the ER? Look, everybody knows vomiting hits fast. Stomach bugs, bad food, motion sickness, there's so many causes of it. Okay? And as a parent, your two biggest concerns are number one, dehydration, because kids lose fluids fast, and number two, nutrition, when and how to feed them again. How do you advance this diet? Here's the thing, you don't need to panic, you just need a calm step-by-step plan, and we'll go age by age so you know exactly what to do. Let's start with babies under 6 months old. At this point, they really shouldn't be on any solids yet, so the focus is simple, it's just on hydration. You can give a half to 1 ounce of breast milk, formula, or Pedialyte Clear every 5 to 10 minutes. And look, keep feeds short and frequent. And if vomiting continues or they show signs of dryness, which is like no tears or fewer wet diapers, call your pediatrician or go to the ER, better yet. All right, and in the next group, I want to talk about babies 6 to 12 months. Here you can also start with Pedialyte, formula, or breast milk in small sips, 1 ounce or less. But if that can stay down for a few hours, try bland solids next, like mashed bananas, baby cereal, unsweetened applesauce, things that are soft and really easy to go down. All right, and you want to wait about 30 to 60 minutes before giving them anything more. Definitely avoid juice, sweet drinks, and anything chunky or acidic, because that's going to come right back up. All right, and for the next group, kids over 1 year old. Again, sips of Pedialyte. I think you're seeing the pattern here. You can also do diluted Gatorade Zero, or you can do apple juice with 1 part juice and like 3 parts water, so quarter strength apple juice. And you can offer about a ½ ounce every 10 to 15 minutes. So look, after a few hours of no vomiting, you can try small bites of bland foods such as toast, applesauce, crackers, plain rice, and definitely no greasy, spicy, or sugary foods. Stay away from takis, all right? What if your child refuses fluids or Pedialyte? Look, Pedialyte can be used at any age, from newborns all the way to geriatrics, okay? It's the gold standard for rehydration. It's got the right balance of sugar and electrolytes. But let's be real, there's a good portion of people, they just don't like the taste of it, okay? And that's the reality. But there are other options. You can try something instead that I mentioned earlier, like diluted Gatorade Zero, where it's about half water and half Gatorade. Another option is quarter strength apple juice, 1 part juice and about 3 parts water. There is also homemade rehydration mixes. You have to be very careful with these formulas, but you can use about 1 liter of distilled, filtered, or previously boiled then cooled water, plus 1 teaspoon of salt, plus 2 teaspoons of sugar. And I want to iterate on a couple points here. If your child's vomiting Pedialyte or any of these alternatives right after sipping, that's a red flag. You can try again using tiny sips every 5 to 10 minutes, up to 3 or 4 more times. But if nothing stays down, call your pediatrician, and if you definitely can't get a hold of them, go to the ER. And I want to talk about some other key signs that you need to know that come back to this whole situation of calling a pediatrician or going to the ER, and that's if they haven't peed in about 8 to 12 hours, or they have dry mouth or no tears, and if they're overly sleepy and just not acting right, that's a red flag. And then also vomiting more than 3 to 4 times with no fluids being able to stay down, definitely red flag. And one very scary scenario is when your child or the patient is vomiting blood and there's severe abdominal pain. All right, that's definitely a red flag, and you should take your child to the ER when you see signs of that. Now I want to address what not to do and what things to avoid. Definitely avoid big gulps of water. Definitely avoid watering down formula. This can be dangerous. All right, definitely avoid greasy, spicy, or sugary foods. Also, don't force food. A bite of banana or toast every hour is plenty while they recover. So let's just recap from the top. Fluids first, boring food second, go slow and watch pee, the energy, and the other cues that your child normally has, all right? And if they throw up again, it's not a failure. Just go back to fluids. And pro tip, you don't need to bribe or force food. If they're hydrated and alert, you're doing fine. Dr. Merchant out.